Okay, so it would like bleed at times, and so I just, like I said, I mentioned it to Dr. Cornejo. He said, just let me know when you're ready to check it out. And I was like, okay. So he would come into clinic. He's like, okay, Sissy, you ready? And I'm like, no, not today. And he's like, all right, let me know. He's like, it looks fine. Like it looks okay. It really wasn't changing after that. And I think it was more because I really wasn't going outside. I wasn't going out like in the beach or in the pool or things like that. Um, so then finally over the holidays, my sisters came up and we had Thanksgiving at my house, and they're like, you know what, you really should get it checked out because it just doesn't look right. And I'm like, okay, fine. So come December, I said, okay, Dr. Cornejo, I'm ready. So he took it out and he sent it out for biopsy. Then we got the results back, and then it came back with as a basal cell carcinoma, which is a form of skin cancer. So, but it still had margins in it. So basically, it's like it still had roots in there. So what he took out, it still left some in there. I mean, we just never really know how much you have in there, or how big anything is until you kind of get in there. So
At that point, how big, how much did he take out? It started out as, like you said, a pin size.
yes, it was fairly small. It was like the tip of a pen. Yeah, absolutely. And then after he was done with it, it may have been maybe like with the incision, maybe like the size of my nail. To be honest, like after he took it out, sewed it up really quickly, like you could barely notice it. It was until so at that time when he got the results back, he let me know and he's like, "Don't freak out." And I was just like, "Okay." When you start a conversation like that, I'm gonna freak out. So I freaked out a little, but he's like, "It's okay. We have to send you out to a specialist." So he sent me out to a Mohs specialist, and which is also a dermatologist, but he specializes in Mohs surgery. And so I went to go see a doctor, but there was kind of a waiting list for him. So this was in December when I found it, and I went February. My appointment was February the 21st, and so that same day, I got the whole procedure done. It's like a kind of like a full day kind of sort of procedure. They don't let you leave until it's all gone, basically. So it was about 4 hours total. Um, I went in there. He just kind of marked my face, and then he just went in and started cutting. And at the time, like when he cut it out, whatever he cuts out, they have to take it to the back and test it. They have a lab there, and so they have to just kind of make sure everything's gone. If for any reason, like if it came back and there was still some in there, then they'd go back and cut some more. But thankfully, it only took one time. And when he cut it out, I was very curious since I wanted to see it. So they hadn't closed it up, obviously, because they were still testing it, and they just kind of covered it up. And when he was about to sew it up, he's like, "Okay, it's all gone. We can close it up already." And I said, "Okay, great." And I was like, "Can I see it?" And he's like, "See what?" I was like, "I want to see this incision on my face, like this hole on my face." And he's like, "Are you sure?" And I was like, "Well, with his tone." And I was like, "Well, maybe I don't want to see it." But I did. I was just very curious to see what it looked like. So it was a little traumatizing for a second.
How big was it after the
It
close,
was
would you
almost like
say?
the size of a dime, like the opening on my face. So, and it was black and white, and because they burn it, as well. So like there was a little funky smell in the room too because I had to like burn it off, and so it was weird. But I looked at it and I was like, okay, that's enough of that. And he's like, yep, that's enough of that. So then he closed it back up, and so he was like, what they do is when they close it up, they have to like stretch your skin a little bit. Like, so they're pulling from here and they're pulling up from up here. So when your skin settles, it just kind of goes back to normal. And so instantly after they started sewing it up, I got a black eye. So I had a black eye, and then these stitches were kind of maybe about 2 inches or so, I would say, like on my face. And so I felt a little crazy looking because I had the stitches, I had this black eye on my face, and I had to come to work, and it's fine, but it was just different. I cried a little bit that weekend because I was like, this is my face. You see your face every day. That's the first thing you look at. You open your eyes, you go to the mirror, and that's what you see that. So, but I was just glad and grateful that it had been taken care of.
And look at how, I mean, it's amazing that from going from those stitches to what you look like now. How did Dr. Conejo help you to minimize the scarring so that you wouldn't have any scars to your face?
So after a week after the procedure was done, I came back to see, I was with Dr. Conejo, so he took out my stitches for me, and then he just continued my care from there. We took out the stitches. It was a little irritated, it was a little red, but then you really can't put anything right away for the scars. So it was just more like kind of let it air dry a little. But once I was able to, maybe a couple weeks later, I started putting on a scar treatment. So it's like a little sticky tape almost, and that's really what we recommend for our patients as well. It's called the Scar Away, and it kind of stays on your skin. You put it over the incision, and it helps with the skin, like the coloring of it. So it helps it heal faster as well. So I use that. And then I use also like a different ointment as well. So I'll kind of like alternate a little bit. But those the Scar Away kind of little stickies, they work tremendously. So I'll sleep with them at night after I've washed my face, and I put it on afterwards, and then I wake up in the morning. It's almost like it's waterproof too. So if I shower in the morning or wash my face, like it doesn't get in there. So you keep it on for about maybe 15 hours a day. So it's fine with me. And then I just take it off, switch it out, and
So
that's
it's pretty
it.
easy, simple.
Yes.
And show us where it is.
It is actually right here.
Okay.
So I mean, if you get that close, yeah, you'll definitely see it. But from far away, you really can't tell, where it was at. Versus like when I first look at my old pictures, the blemish that I actually saw before, and I was like, man, that was noticeable because of the color that it was. It was dark, it had like a little trimming around it, and it was kind of, you could see that even when I put makeup on. Since I said it was almost like a crater kind of goes down, so the makeup wouldn't really cover that. Like you're still able to see that little indentation in my face at the time. So, but I mean, I'm very happy with the results now. I'm happy that I got it taken care of. And you know what, I use sunscreen like no other now. So I use it all the time. I had to up my game on the sunscreen on my face. Now it's a 35 SPF. I have to put it on before I put on my makeup and all that good stuff. So it's really important, to kind of take care of that. And like, I'm only 35, and it doesn't really matter how old you are. I think if you're exposed to the sun enough, that it can happen to you if you don't take care of it. And so, I'm on it now. I sunscreen on my hands, my face, everywhere.